program, I think, is especially meaningful to all of us since healthcare is so important to our local economy. Along with the quality of schools, when new companies come to look at an area, they look at healthcare. So it is right there at the very top of concerns for small businesses and our economy. This clearly is topic number one in Ulster County this year right now, and I ask you to please join me in welcoming the President and CEO of Health Alliance of the Hudson Valley, David Lundquist. David?
Thank you, Ward. About 3 months ago, I was sitting in a board meeting with Ward, and we were going through another month of reporting the complexities of healthcare and the changes that have been rapidly approaching all of us in this business of healthcare over the last, particularly the last 2 to 3 years. And Ward mentioned at that time, he said, you know, it may be good for you to come in and at least shed some light on the changes and give some insight as to what's really going on behind the scenes in healthcare. And I said, sure. Little did I know that it would take on the presence it does today at that point. I know that this is a serious topic. There is no question about that. What I'd like to do today is to possibly connect the dots for you, answer the questions. What happened over the last 3 years since the Alliance came together? What is it? What are the factors and the challenges that we've been facing over the last several months and will continue as we go forward? And then possibly give you an insight as to the process that we're going through right now so that we will come out of this better and stronger. Please understand, no matter what you've heard, we are more committed than ever because of the strengths of this community to come out of the changes that are necessary for us to move forward better and stronger. We are not rolling up the sidewalk and going home. In fact, we're doing the opposite. We're positioning ourselves to accelerate, to grow in areas that are needed in this community to stabilize and become stronger. Hopefully, at the end of my remarks, you will be able to better understand what that challenge means and certainly get a sense of the commitment of the team working on this effort, yourselves included. There's no doubt the importance of the hospital to this community, both its physical and economic strength. In my role, I have the privilege of working with some amazing people. Over 200 physicians that have located in this community and offer the best of health care. Not fully appreciated nor understood by the community as evidenced by the out-migration. But we truly do have an exceptional team of people with our physicians, 400 nurses, 2,300 employees dedicated to making life better in this community. 1,500 dedicated to the 2 hospitals in Kingston. We have Margaretville and Mountainside up in the community of Margaretville, and we have Woodland Pond that opened in September of '09, serving the community of New Paltz in a continuing care retirement community, a unique model that certainly has very strong value to this region. So, but let me step back. One of the questions, I'm hoping that I can, over the course of my comments, answer many of the questions that have come at me and at several of those who worked with us. But I'd like to step back a bit. Well, first of all, one thing that came out immediately is, well, given the challenges we're facing right now, the Alliance failed. So it didn't get the job done that it was intended to do. I take very strong issue with that. Because we're here today because the Alliance did come together. Let me give you some facts. Step back 4 years. Several years of instability among the two hospitals, as evidenced by the 3 previous years, 6, 7, and 8, all incurring operating losses. Outmigration. 50% of our community goes outside for care. Now that's not 50% of open heart surgeries. That's 50% of the care that can be provided at our hospitals in this community, and provided exceptionally well. 50% of the community goes north or south. The operating losses were incurred. The community, despite attempts in the past, stepped up above the fray, had the courage and the vision to pull the alliance together. Out of that, obviously, came assistance from the Berger Commission. The alliance came together for some basic reasons. One was to preserve and enhance health care for this region. 2, keep both hospitals open and respect the individual missions. That was specifically stated as part of the alliance. Truly unique in the world of healthcare. That's why we were referred to as the poster child of the Berger Commission, because this community embraced the essence of the challenge, combined the two, keeping both open, and as a result, preserved jobs, not a job lost to a reduction in force. In fact, we created some in the ensuing months. We also, per the Berger Commission, reduced beds. Went from a total of 382 to 300, with each of the 2 having 150 licensed beds, for purposes of distributing the care in a way that can better serve this community. And as a result, balance and keep both open. The Berger Commission pitched in $47.6 million. 29.1 of that went to capital projects. Keep in mind, none of this went to operations. It went to capital projects to assist with the distribution of services. 18.5 went to debt retirement to take some of the pressures off the 2 hospitals. And that money came with very tight restrictions. Had to be done in 12 months, with a few months to do some planning. We didn't have the luxury of a lot of time and effort to put that together. Out of that alliance, we did achieve every one of the original intent. Preserve and enhance the care. Keep both open, preserve jobs, and to reduce beds. Now, there were many other benefits that came with that, but if you peel it back, those were the basic ingredients. We can be very proud. That first year, we peeled $15 million of operating efficiencies. Made a profit, $4.9 million, for the first time in years. Collectively, this was putting the 2 hospital organizations together. We immediately gave raises to employees, a 3% raise for the first time in 3 years. We've also given 2 subsequent raises to our employees. One in August of 10, the most recent June of 11. So we reinvested the dollars in retaining and stabilizing as much as we possibly could the employment in this great community. So, we also made progressive strides in the area of technology and service growth. We saw 30% growth in our orthopedic business in the establishment of our joint center, 21% in our vascular services, 10% in our cardiac business. So we invested in these services that were so needed in this community as a result of the Alliance coming together. Now, had the Alliance not come together, one of the hospitals would have closed then, losing over 700 jobs. So when you refer back or you hear that the Alliance did not work, it did. Now, little did we know the effect of the economy. But before I get into that, let me send a special thanks to our foundations through this period of time. The Benedictine Foundation, we've been able, through their investments and donations, to establish a regional press center that we've seen our volumes grow with very happy and satisfied patients and families. The Infusion Center, state-of-the-art, providing services to those in a very painful part of healing. And the Pre-Surgical Center, all of these funded by the foundation. The Kingston Foundation, the Emergency Department that allowed us to consolidate both emergency services. Yeah, we had some problems early on. You will always have situations in the emergency area, particularly when we're as busy as we are. But we serve our community in the best manner possible. And I've heard many more good comments over the last several months than not. Our 30-minute door-to-doc, we meet over 90% of the time. That's the start of the care in our emergency. We've also received generous grants from the Dyson Foundation. We also have been blessed with the support of our elected officials. County Exec Michael Hine, State Assemblyman Kevin Cahill, extremely supportive of the Alliance as it came together, providing forums, etc., for those to voice and to feel a part of the process. And since then has been instrumental in our efforts to achieve the MSA, as well as achieving our most recent grant of $250,000 for the breast center. Also, Senators Bonacek and Larkin co-sponsored a $1 million grant for our electronic health record 3 years ago. And we're still working with our friends at the state to achieve that. Had a bit of a glitch last week, but we were able to clear it. And Congressman Hinchy, obviously. We've come close to the MSA, but it's not in the foreseeable future. Now, that was the first year. The Alliance was successful in that environment. The end of 2008, the economy collapsed. In years past, I've been in this business over 30 years now. During recessionary periods, healthcare grew because people under stress, etc., sought medical care. That was the previous recessions that I was a part of. Not this time. It's been said many times. In the past, healthcare and education were immune to recessions. This time it hit all of us, and it hit us deep. Everyone in this room has been affected by the collapse that occurred back in 2008. We didn't feel it until the end of 2009. But we felt it, as have you. I don't know of any business that has not been required to redefine itself as a result of the changing economy. We're no different. We just happen to be the largest employer and a bit complex when you look at all the services that are a part of our service package to this community. But we're not immune to the changes that are needed. Also, the healthcare industry, along with the economy, all of a sudden decided to change what it had been talking about for decades without any significant action. And in the last 3 years, I've seen more significant change than I have in the previous 30. Initiated by the reform movement and the subsequent changes that the Medicare system needed to do in order to survive over the long haul. And it does and has affected us significantly. Just some facts. Moody's Investor Services recently downgraded the nonprofit hospital sector to a negative outlook. More reimbursement cuts are coming. Hospitals everywhere are cutting. We're not the only ones. 6,300 layoffs in the New York State alone in the last 2 years. Until recently, we did not. This is a scary fact. According to the Employee Benefit Research Institute, workers with medical coverage through employers is at 51%. So coverage, obviously, has been affected. Demand has declined. Now, these are all changes in the last 2 to 3 years, more clearly and most significantly the last 2 years. Many patients are putting off elective procedures because they can't afford it, or for other reasons choose not to pursue elective care. Payer incentives away from hospitals. Many of you have been faced with this. If you can go to another facility, including a physician office, and get the same procedure, same physician, with a $50 copay versus a $200 copay if you come to the hospital. Now, we don't necessarily have direct control of that. We could drop our rates to match what the doctors do, but remember, the physicians are not open 24/7. They don't provide care to those that are the sickest 24/7. The physicians are doing what they have to do to survive going forward. That's part of the industry shift. I wish it wasn't that way, but in order to support our physicians, we're reaching out to them in ways that we can help them do that so that we can be available for the patients when they need the most severe care. That's part of the new world, and we must adjust with it. In 2010, Ulster County's total inpatient discharges were down 3%. 2,000 fewer outpatient surgeries, down 8%. We incurred a $2.7 million loss in 2010. Now that also carried with it some financial adjustments for depreciation and others, because we had $25 million of capital projects that we had to depreciate. 2011, we began to see further deterioration. Inpatient volume firmed up. Our inpatient volume has been steady, and we've seen some growth in comparison to 2010. We feel that going forward, with the changes in the demographics, even though there are incentives to keep patients out of the hospital, with the baby boomers hitting, living longer with more health issues, we will be able to stabilize. We do not see treating any fewer inpatients going forward. So our role is adjusting. On the flip side, where we had 50% of our revenues over many, many years coming from outpatients, we've seen a cliff-like decrease in outpatient services for the reasons that I described. People electing not to do it, procedures going out of the hospital. In 2011, that was over a $5 million decline in revenue. It's real. This is not a cyclical dip. It is an industry shift. Now, these are all things that have occurred in the last 2 years. Another important factor for this community. Between Medicare and Medicaid, 60% of our health business is funded through Medicare or Medicaid. That is higher than the surrounding communities. Now, get back to the favorite topic that comes up in every meeting I have. At that level, the MSA and the wage index takes on a huge impact. $10 million a year. Now, there have been many efforts to address that over the last 8 years. We've accelerated it. The latest proposal sitting on the desk of the Deputy Director of the CMS, quote, "We have convinced him personally and his staff that we are the worst wage cliff in the country. The Kingston hospitals are the worst. Due to the political environment, it cannot be advanced at this point." But it's not over in my mind. But it's not in the foreseeable future. So, hopefully I've given you some background as to why we are where we are. Some of the reports have been a bit extreme. That's facts of life in human nature. So, what we're dealing with at this point is we have over 600,000 square feet, 2 hospital facilities, 300 beds, 70% occupied, utilized. That's an unsustainable business model in any business. We take our responsibilities extremely seriously. We've been at this now for over a year. We saw the tea leaves, we saw the changes, and I didn't mention this earlier, but we have over 117 individual members of this community who donate their time, effort, expertise, guidance, and leadership to this community. Far greater than any community I have ever worked with in my career. It is truly amazing to see the support of this community as evidenced through its board representation. Our job, my job, and the job of our executive team is to support our physicians, our nurses, our employees, our board, and the community. We are committed to getting that accomplished with a lot of moving parts. But with your support, we can get it done. The mandate is that we cannot continue to operate the way we've operated in the past. Doesn't work when you're operating at 70%. We didn't create that. That's the forces outside of us. So we didn't create the problem, but it is our problem. And it's up to us to work together more than ever to be sure that this community gets the best health care that it deserves. We need, though, to become better and stronger, we need to shrink some. We're so spread out at this point that we can't truly support the services that should be provided to this community. And like every business, we take that seriously, and we're doing it in the best manner we know how. We're diving deep and wide. We're looking at every phase of our operation to be sure it's being done the best it can be done in the most efficient manner, which requires us to reduce our operating costs. Now, what hit the headline was the closure of a hospital. We don't know what the final answer is yet, and that is an honest statement. We are looking at every piece of this puzzle to be sure that we do not overlook anything. In my previous discussions with the Chamber, I had slide presentations and I showed the complexity of all of the entities that we work with and have had to account for and to. I'm not going to do that again. But we have, as pieces of our decision tree, ownership issues, the Department of Health, the Office of Mental Health, our physicians, the core of our care, their preferences and their needs, the community preferences and needs, reimbursement differences. The world of healthcare is a strange duck financially. I'll just take an example. Our Joint Center. It's currently located in Benedictine. If we move that to Kingston, it's reimbursed differently because of a term called dish payments, which is a proportionate share of that particular operating license that applies and does affect your reimbursement. So there are multiple layers here that must be explored before a good decision can be made. Capital. For us to shift, we need capital for either option. We also have health industry changes and requirements. We're now we're within 1 year of implementing our electronic health records, a $15 million investment that puts us on the front edge of healthcare delivery from an IT perspective. And oh, by the way, it's mandated. If we don't do it, we get penalized further. Value-based purchasing, a weird duck term for changing how we are reimbursed. No longer will we be reimbursed over the next few years on a per-click basis. We will be paid for quality outcomes. And we're already under the microscope for that. We'll see the first effect in 2013. It will escalate. Right now it's about $300,000 as an organization. In 5 years it will be several million. And a scorecard determines, and we pay that, by the way, up front. And then we earn it back. And to do that, you have to be in the top 10% of the nation, which has been part of our mission over the last 3 years. By the way, we've arrived in several of the categories. We've got a few left, but we're well on our way to get there. Thanks to our physicians and our dedicated hospital staff to doing the right thing. Reform reimbursement will continue to provide incentives to keep patients out of the hospital. We cannot ignore these things. We must, unfortunately, embrace them, understand them, and adjust so that you get the care that you deserve. Facility constraints. We have Benedictine, the larger of the two hospitals, 20 acres, larger hospital. We own 78% of the behavioral market and growing by default because everybody else is getting out. It's a big piece of our mission, something that we do very well, but it comes at an expense. Benny doesn't have an emergency department, which would require capital investment. We're working very closely with the sisters and others to be sure that as we go forward, all parts of our puzzle are considered and given the appropriate level of respect. Kingston Hospital does have an ED. Smaller, landlocked, parking. Both of these hospitals have provided excellent care over the years. We don't know what the final decision is yet. Over the next several weeks, we'll have some preliminary idea. But it is important so that we can answer your questions, that we be allowed to get the facts, so that we can work with you and all of our community leaders. What we do know is that we must change. We got two choices. We can ignore all the factors that are changing and shut the doors entirely to this community, or we can step up, take it seriously. It's not a pleasant journey. It's tough. But hit the challenge head on. Working with our boards, our physicians, the sisters, our employees, our elected officials, because we do believe, honestly, there are some opportunities for relief out there, and I think we do have a very compelling story. Regulatory agencies, and of course the general community. That's our responsibility, and as I said earlier, we take that very seriously. We are exploring any and all affiliation opportunities and partnerships. We are a bit unique in that we have a partnership with a payer. CDPHP is a partner of ours and is helping us work with our physicians and integrating better with our physicians, as well as being a payer to our organization as an employer, and is working with us to develop a community health model to better serve this market. That's not excluding the MVP or the Empires or the others. It's just that they were willing to step up and work with us. Truly unique. In years past, that was a line never crossed. We're working with other hospitals in ways to share services, share resources, link. One of the things that we knew coming into the alliance is that it was never an end result. The alliance was the first step for this community to align with and become a part of something bigger. But you don't have to sell your soul. You can align, you can partner, you can bring value to a relationship that is valued by a larger entity. There are efficiencies that can be gained from that, and we certainly have been and will continue to pursue those opportunities. So, our job is tough, but we have a very, I think, solid team of people. We need to pull together. We need for our community to stay home, to receive the care. Check it out before you go north and south. And if it doesn't meet your standards, call me personally. Because I want to know. Right here. For those of you who've done that, you know I am true to that commitment. My door is open to our employees, to our physicians, to our community. Many have taken advantage of that, and I promise you I will follow up. And for those of you who've tested me, I think I have passed. So, I don't know if this has been helpful to you going forward. I can tell you that it is tough, it's scary, because we don't yet know what that future looks like yet, and probably won't know for a period of time. But if we work together and support each other, we'll get there a heck of a lot sooner. And by that I mean, challenge us. Stay home. Expect the best. Let us know what your thoughts are so we can better serve. Questions?
Challenges. I spoke to one of your senior staff about the model where you have doctor's offices in Tom D, and I look at Northern Dutchess, you know, where they're integrated into the hospital itself.
Mm-hmm.
And then I said, maybe this might be an opportunity, since you obviously have to be consolidated, to bring in more of these doctor's offices in whatever building is not going to be fully utilized. And then his response was, that's a great idea, but the trouble is the doctors are now building a whole new facility across from Adams, which will be consolidating, yes indeed, but on a whole new site outside of the core area of Kingston. And to me, that's absolutely bad public policy.
Well,
I just wish we could, I don't know what can be done, but I just want to raise this as to me, a great concern and a loss if they just build out there and your buildings are.
well, you've hit on my reference to looking at any and all affiliation and partnership opportunities. The last thing in the world any of us in this community want is a dark room. So we're reaching out. I have a meeting immediately following this with a consortium of agencies and physicians and services that have some, I think, some encouraging possibilities to address some of that. We do not want vacant space. None of the community wants vacant space. Let's take advantage of this. We just can't carry it ourselves for the reasons described. So we are reaching out. We are looking for creative ways to expand the presence and the diversity of services. But we need to do that working in partnership with other entities, other agencies, other services. And so the door's open. The problem that you identify there, we don't have much control over. And that's part of what this, now, the fact remains, the question is still out there. It's an 80,000 square foot building. That's a lot of space. And in this day and time, is that possible? We don't know. But we met with the principals of that organization yesterday. If they're going to be in our market and we can't keep them out, then we are going to work with them to be sure we get their inpatients. If we get commitment on all of their inpatients, that's better than getting nothing. And so it changes the whole way we think. And in order to go forward and to make the adjustments that are needed. But your concern is spot on. So we're doing what we can in that regard. Yes, Ursula.
Thank you for your brave speech, by the way. In view of the current realities, the fact that Hudson River Psychiatric Center just recently closed, and that the Health Alliance at the Kingston campus has its psychiatric ED, and the Benedictine campus has the only inpatient behavioral health services in the region, could you just maybe briefly comment on where you see the future of this very expensive but very, very critical service to this community?
Well, you've hit the button. The meeting I have later this morning is with a group of individuals who have historically not worked together on that very topic. I do know that the Department of Health, when we talk about our challenge, and again, there have been no decisions, but if there is any question about behavioral health, they begin to stutter. And that may be a good sign, because we need some support. There are services in behavioral health that are not served in this community, particularly in the area of adolescent coverage, geropsych, and other types of services that are out there. But again, I re-emphasize, that is something that would have to be a collective coming together to address it. And the financial commitment, both on the rate and the capital side, are significant. And we don't yet know if there's a solution, but we're pursuing it. Because what you just described, you know, if it's not provided, what happens? It can be catastrophic for the community, and I don't, you know, those are the concerns. So we have our sights very much on that one.
I just want to say that as the only psych rehab provider in Ulster County, we Gateway Community Industries are willing to work with you, and you provide an excellent service. Thank you.
Well, we will include you in our discussion.
Sue, over to the right. Sue.
Hi. Thank you for a very, very informative and very gutsy talk. That really answered a lot, and you deal with a lot of that just to stay alive at the goal these past 30 years. And thank you so much. I don't know the ramifications, but I've heard Golden Hill Nursing Home, the building wasn't good. Is there any possibility of moving that into Kingston Hospital?
Well, that topic has been suggested on several occasions. It is a topic, obviously, there are, with each one of these options or concepts or issues come multiple layers of challenges. But that's where we are now, is diving into each of these to determine what is, again, we want to make the right decision, not just a decision. But the time frame is very short. To give you an idea, and what was interpreted, and again, we would have preferred that the news break a bit differently. As I said, we've been at it for really the better part of a year, but we were on a more methodical pace of looking at all of our options. What's the ideal bed count? Where could and what are the best locations for the services? We knew we had to reduce. We weren't quite sure how much and where it would go. With some events that occurred over the last few weeks, that schedule was accelerated. And then we get a call that says that, and this was vetted through all of our boards. So we've tried to keep our boards as up to date as possible on each of these issues. Somehow the word got out that our schedule was accelerating to look at our options because of the financial pressures, cash demands, etc. And we had 2 of our employees anonymously call our local newspaper and say that they had facts that suggested that both hospitals would close in 90 days. Did we have a comment? Now, been in the business a long time, and the no comment is a death sentence. So we issued the press release, and then the rest is history. So the idea is now facts and the truth. So let's keep things in perspective. It's tough enough as it is. And work together. If you have any questions or you hear something outrageous, give us a call.
So my question is, what are you doing to help, shape the story, to help get the word out about why it is that people should stay in this area for their health care, and continue to shape the story about what's happening?
Well, we have, and Paul and I have become regular communicators, and we remain open. You won't get a no comment from us. I know Cynthia Lowe, our chair, has also been available. And so anytime there are questions, we are available to be sure that we can give as straight and as good information as possible. Now that addresses the ongoing questions, because obviously the questions have, come out pretty strong. The way it was communicated, we had a communication plan that was going to roll out more methodically with meetings within our organization to allow that to happen, but given the circumstances of that event, we didn't have the luxury of being able to do that. The only thing that I can say in that regard is we're available at any time for the facts as we know it and the truth. As far as educating the community on what services are out there, we are actively engaged in what I will call marketing, but it's in educating the community on the services we do provide. I would love to hear any ideas on how we can be better at that. So, but I think it's a gold mine that has not yet been fully appreciated by the community. Because of some loyalties in the past to either or, if we can get beyond that and look at the community in general, and look at and appreciate the services that are available, I think we can all win with that. We're still at 45% out-migration. And that, if you change that to 65 to 70% of our market, makes a huge difference in our ability to support our services. So,
Maybe one or two more.
I have a question to ask. We take a lot of people up from the city and metropolitan areas and they need detox. The insurance companies play games with us, and they keep people maybe for 12, 14 hours before they'll give them an okay whether they can get hospitalized or get detoxed. We have a lot of programs that we work with in New York City and around the areas, a lot of safe programs. If we could get something together with the hospital, we send a lot of people up there, but sometimes they're only kept for maybe a short time. I'm not saying that they have to drag that out, but a lot of times they're sent out and the next day they have a seizure, the next day they have something else. I think if we could look at a couple of beds for detox, we have some, but the utilization of them I don't think is utilized as much as it should. And maybe if people were together, the hospital and us, and we kind of got in touch with some of the programs that we work with, they really are anxious to get people up in this area and into the two hospitals, but they're not being treated the right way, not at the hospitals, but at the insurance company.
right.
So if you guys can have something to do with that, I think it would make a big difference.
Absolutely. You touched on something that is a very subtle change in the industry. When you look at, and for those few who have worked in this industry, when you look at close to 50% denials on claims, stories of individuals getting pre-approved, and then the patient comes in and then they deny the claim. It's a game played by the payers to delay payment. Now, the indicator on that there's some artificial stuff going on is when you see 50% denial and then you get back 90% of that 50% on appeal. That's game playing. And it has escalated out the roof, which adds a cost factor for us, a complexity, a frustration level that you've just described. It's horrific. And what we do realize is the people, and this is what I tell our staff, who come to me in tears, trying to get patients placed, is that we're going to escalate it, and numbers do create critical mass, and I'd love to reach out, because the more different partners we can get in this, the stronger we become. But it's, the individuals on the other side of the line are paid to deny. They're provided incentives to do that, and it's sad. But that's part of the reform movement that has to be changed, and we need some help, you know, from the legislative perspective and others, because it is a crime to see the patients and our staff go through that process. It is ugly. So
we're gonna have to run. It's past 9 o'clock.
Politicians and the legislators can help us with this.
well, we have very active legislative support.
We're not doing anything for people that are dying.
Well, I think raising the awareness will help with that.
Okay. Can you stay for a few minutes here and ask questions? Thank you all. It's 5 after. We try to get folks to work on 9.
Our next breakfast meeting, June 20th. See you back here.
Alex, good job.
You've got to press the button. That's it.